let us start. Welcome, Dr. Bruze. It's great to have you on Stroke Support India.
Thank you.
For this session for stroke survivors and caregivers, and to share with you as well as learn from you how your journey has been. And it is interesting, for me also, and I'm sure for many others, to see your background both as a neuroscience professional as well as a magician. It's a interesting, I would say, roles that you have been playing. And I see that you are still very much into magic and trying to get back into it again. And,
yes, I'm trying to.
Right. And you were a professor of psychology and neuroscience.
Yes.
At
Lawrence University.
At Lawrence University, when stroke happened to you. And that was about 10 odd years ago. And
yes,
since then, you have recovered wonderfully also, and it's also your passion to interact and to share your learnings and your journey with the other stroke affected. So welcome again, Dr. Lawrence. And I would just start with, if you could tell us something about your background. How was it before the stroke? What was your lifestyle? What was your, as a neuroscientist, perhaps you had some information about stroke. What were you doing before that? Was it what kind of a lifestyle were you leading?
Okay, shall I start now?
Yes, please. Yeah.
Okay, thank you. As you said, my name is Bruze Hetzler, and before my stroke, I was a professor of psychology and neuroscience at Lawrence University in Appleton, Wisconsin. I was also a magician. I taught at Lawrence University for 43 years. And I taught classes in psychology and the brain. In terms of my research at Lawrence, I was into drugs. That is, I looked at the effects of drugs on brain waves and behavior in laboratory rats. The main drug that I studied was alcohol. I was a member of the International Society for Biomedical Research on Alcoholism and presented my research at international alcohol conferences around the world. For example, in Yokohama, Japan, Paris, France, Helsinki, Finland, Cardiff, Wales, and other places. And I was a magician the year before my stroke. In addition to teaching and doing research at Lawrence University, I gave 100 magic shows. So I was busy, but I loved it. So my stroke occurred on July 18th, 2011. My wife and I had just returned from a meeting in Pittsburgh, Pennsylvania. We flew into the airport in Green Bay, which is about half an hour north of where we live. I drove us home. My wife got out of the car, went inside to take a shower, and I carried in the luggage. When she came down after her shower, she found me on the floor of our kitchen. She called 911, which is the emergency number. An ambulance came and took me to the hospital here in Appleton. There, they determined that I had had a stroke and sent me to a different hospital, one that specializes in stroke treatment. At that hospital, it was determined that I had had a hemorrhagic stroke in my right thalamus. That's a subcortical area inside the brain.
If I may interrupt, prior to the hospital's diagnosis, did
Yes,
you had any clue, your wife or you, or were there some, as we sometimes talk about some risk factors like blood pressure or I don't know, stress at work?
my
Did you have
blood
it?
pressure, my blood pressure was high. It was being monitored. That is, I would report weekly to my doctor with blood pressure that my wife and I had recorded, but I was not on medication for it. So, in retrospect, I wish I had been, but I wasn't.
And otherwise,
So,
physically, you were fit, no job tension or no other stress factor. Physically, leave aside the blood pressure, no diabetes, no other kind
no
of thing.
diabetes, no other risk factors. I'm rather slender. I'm not overweight. I did notice, I think a day or two before my stroke, that I was beginning to see double, have double vision. Anyway, as I said, I was taken to one hospital, then sent to a second hospital, where it was determined I'd had a hemorrhagic stroke where a blood vessel burst in my brain. A neurologist there told my wife that the situation was grave and I would probably not be alive the next morning. A neurosurgeon drilled a hole in my head and put a tube in to drain out the blood. So when my wife came in to see me, I was also put in a drug-induced coma for 8 days. So when my wife came to see me, I was on a ventilator with a tube coming out of my skull, filling a bag full of blood. Not a pretty sight. In fact, my doctor later told me that when he first saw a CT scan of my brain, he assumed that I had died. I think he was wrong.
Yeah, we can see that, thankfully.
So when I was in the drug-induced coma, another neurologist told my wife that if I survived, I would not be the same person. So she had better prepare herself for that. As it turned out, he was wrong. I'm still the same smart aleck I was before my stroke. So after I came out of my coma, I was too weak for physical therapy. So I was sent to a nursing home for a month. During that time, my wife came to see me every day. And it was that, more than anything else, that kept my spirits up. After a month at the nursing home, I was sent back to the hospital for 3 weeks of inpatient therapy. I had physical, occupational, and speech therapy. My speech was not affected really. It was mainly memory tests, if I remember correctly. So after the 3 weeks of physical therapy, I was finally sent home in a wheelchair. I thought everything would be better when I got home. This time I was wrong. We had to move. We have a 2-story condominium, and we had to move the bedroom from upstairs to downstairs because I could not climb the stairs. Also, I realized that I could not drive a car. We had 2 cars, and both were manual transmissions, the stick shift. My left foot could not operate the clutch. and I couldn't turn the steering wheel. So I took driver's lessons at another hospital, and we sold both of our cars and bought a single car with an automatic transmission. After the driver training, we got some modification to the new car. We had a knob put on the steering wheel so I could drive it with one hand, and an extension from the turn signal that went behind the steering wheel so I could operate that with one hand. I then had to regain my driver's license. I had to take a computerized test and a driving test, and I passed both of them, so I got a new driver's license. In October or November of 2011, I went to see the neurologist that had been there the night I first had my stroke, and the one that told my wife I would probably not be alive the next day. I went in to see her with a walker. I had transitioned to a walker, and she got tears in her eyes. She did not expect me to still be alive. I was totally unprepared for the changes in muscle tone that followed my stroke. First, the flaccidity of the weak muscles, and then the spasticity. I learned about them by reading the book Stronger After Stroke by Peter Levine. Now in its third edition, and I think that book should be required reading for anyone who has had a stroke. I missed 6 months of teaching at Lawrence, but then went back to teaching in the spring of 2012. Before I could resume teaching, I had to take an 8-hour neuropsychological test to prove that I still had the cognitive abilities necessary to teach. I passed that test with flying colors.
Great.
And returned to teaching. In fact, I have written and published 3 scientific articles since my stroke. So I can still think and talk.
Wonderful. Yeah.
Or I wouldn't be here today. I do have post-stroke fatigue. That is, I do tire fairly easily. But I'm not tired of this. Initially, I also had unilateral neglect. That is, I tended to ignore things on the left side of my body. For example, when I was in the hospital, a doctor came to my bed and lifted my left arm and said, "Whose arm is this?" And I said, "That's Matthew's, that's my son." But he wasn't in the room, and it was obviously, in retrospect, my arm, not his. Also, when I was in the hospital, sometimes I would be seated at a round table with doctors and therapists in front of me on both sides, and I would pay attention only to the ones on the right. I was later told that the ones on the left were saying, "Hey, Bruce, look over here, interact with us." But I would ignore them. That unilateral neglect is gone now. And it was gone when I took the 8-hour neuropsychological test. Because one of the things they had me do was to draw a clock.
Okay.
A stroke survivor is often asked to draw a clock.
Yes.
And I drew mine perfectly with all the numbers in place. But if you have unilateral neglect, you tend to put all the numbers on the right-hand side of the clock with nothing on the left-hand side.
And this was how many months after the stroke event that the neglect you felt was gone?
Well, the unilateral neglect was gone within 4 months of
It
the
went by
stroke.
naturally. You did not do any special exercises to encourage.
I did not do any special exercises for that. I had double vision, and I did take some eye exercises for that. And I have been in and out of physical therapy ever since then. I even went to see Edward Taub's clinic at the University of Alabama in Birmingham, Alabama. Edward Taub is the one that developed constraint-induced movement
I
therapy.
see. Okay. Mhm, mhm.
And so I went there for 2 weeks for my left arm and 3 weeks for my left leg. Now, I don't know if you all are familiar with constraint-induced movement therapy. The idea is for the arm, I had to wear an oven mitt on my right hand, so I could not use it and was forced to use my left hand. Now, they can't obviously tie your right leg down and force you to walk, so it's more complicated for that. But the idea was I had to wear this oven mitt on my right hand for 4 hours a day, 5 days a week, using only my left hand. And that did help, although I went for that therapy while my muscles were still flaccid, and they became spastic later.
Okay.
Now, my spasticity was never as bad as other stroke patients that I've seen. In severe cases of spasticity, let's say if it was my right hand that was affected, the hand would be clenched and the arm held against their chest. That I never had. But there is increased muscle tone in my left hand. So I'm still working on that spasticity, even though it is relatively mild.
And you did not need to, talking of spasticity, you did not need to take any specific drugs such as baclofen or anything like that.
I was on baclofen for a while. I stopped taking it. And by the way, you cannot stop taking it cold turkey. You can't just stop or you'll have seizures. Since I taught a course in psychopharmacology, I understood that and gradually reduced my dose. But I did not, there were actually 3 reasons I stopped taking the baclofen. 1, I didn't think it was helping me that much. 2, before I had a stroke, I had conducted research on the effects of baclofen in laboratory rats. And I did not like the way it affected them. 3, and this one's more complicated. In 2015, a study was published in the Journal of the American Medical Association. And the title of that study was something like Anticholinergics Increased Alzheimer's Disease in People Over the Age of 60. Well, I'm 73 now, so at the time I was over the age of 60. Now, in that study, they examined 3 classes of drugs: tricyclic antidepressants, antihistamines, and bladder antimuscarinics. All 3 of those classes of drugs have what are called anticholinergic side effects. Things like dry mouth, constipation, mental clouding. And what they found was, over a 10-year period, those patients that were taking those drugs, and the higher the dose and the longer they took them, they tended to develop Alzheimer's disease. Now, how does that deal with baclofen? Baclofen is a drug that affects the gamma aminobutyric acid, GABA, system in the brain. That's the main effect. But a side effect is strong anticholinergic action. And I was not willing to trade reduced muscle tone for Alzheimer's disease. So that was my decision. I'm not recommending that for anyone else. I'm saying that's what I did and why I did it. Because baclofen is the main drug used in treating spasticity. There are others like tizanidine, but baclofen is the main one. People that have strong spasticity will often get a baclofen pump put into their spinal column. So in that case, the dose of baclofen is about 70 times less. Okay. End of lecture.
Okay, I'm seeing Arvind has raised his hand, so we'll interrupt it a little bit. Arvindji, maybe you can ask your question.
Is it okay if I could speak to him directly?
Yeah, do that. Yep.
Mr. Bruze, I'm like interested to know more about the constraint inducer therapy that you have been through at the Alabama University you're talking about.
Couldn't quite understand the question.
The constraint inducer therapy that you went through, like you had to.
Okay, he's talking about the constraint induced therapy that you went through.
Right.
Although yes,
right.
it is now being talked about in India also, but yes, still perhaps not very much practice. And just some details on that. How do you think it helped you? That's what Arvind is asking.
I think it did help me a lot, but again, the motor changes have a mind of their own, and spasticity developed anyway. But my therapist back in Appleton were amazed at how mild my spasticity was, and that was probably in large part because of the constraint-induced movement therapy that I had taken. And basically, it's most obvious for the arm and hand. You have to put your good hand in basically an oven mitt, so you cannot use it.
Okay.
And that forces you to use the hand that was affected by the stroke.
Okay, so just a follow-up question. So if I want to pick up a bottle, should I use my right hand to open my fist? I mean, my fingers goes into a fist automatically.
If your fingers go into a fist, then you need to use your other hand to loosen that fist.
Right.
That's called passive movement.
Okay.
And even passive movement can trigger neuroplasticity.
Right. I've read about that too. Yes. And I actually have to use the right hand. I mean, with the oven mitt, I use the oven mitt to open the hand passively. Is that what you're saying?
No, the oven mitt is used on the hand that's normal.
Yes. So if I want to undo the fist, so I need to.
You obviously, if you're on your own, then you obviously cannot open the fist if you've got an oven mitt on the other hand.
Yes.
But if you have a caregiver with you, that person can open the fingers.
Okay, got it.
Just coming back, sir, broadly, thankfully, as I'm hearing, you got the treatment in time, and although doctors around were not very optimistic, still, wonderfully, you surprised them and you recovered with, as I'm seeing, very little, cognitive deficits or even speech deficits, etc., to the extent that you got your job back also. And you were in that job for how many years after that, sir, Dr. Bruze?
You're talking to me, correct?
Yes, that's right.
I went back to teaching for 8 more years.
Okay, yeah.
Before I retired 2 years ago. Now, some doctors today will still think that you can't get any better after a stroke after 6 months, because that's what they learned in medical school. But that is not that is not true. You can always get better if you put in the time and the effort. Regarding speech, that is difficult to recover from, but not impossible. There is a brand new study just published this year that was conducted in Finland. And this was conducted on patients that had just had a stroke. So it was in a month of their having a stroke and having lost the ability to talk, what is called Broca's aphasia. They were divided into 3 groups. One group listened to vocal music of the genre they liked. It could be country western, opera, rock, or whatever. They listened to vocal music for an hour a day for 2 months. A second group listened to instrumental music for an hour a day for 2 months. The third group listened to speaking, basically audiobooks, for an hour a day for 2 months. A month after that, people in all 3 groups were tested for their ability to talk, and they were also given a functional magnetic imaging study of their speech area in the left frontal lobe. And what they found was that in the group that listened to vocal music, they could talk better than people in the other groups, and they had stronger axonal connections, neural pathways in the left frontal lobe. So people that are suffering from Broca's aphasia, that is an inability to talk after a stroke, should listen to vocal music for an hour a day. That seems to be currently the best way to treat that. There are other treatments. One is to have them sing their answer rather than just try to say it. And that's called melodic induction therapy. That is also helpful, though not as helpful as listening to vocal music.
Interesting. Did they also specify what kind of music, vocal music? Does the study also talk about that? Because here in India,
the study says it's whatever type they enjoy.
What is that again?
The type they like to listen to.
Mm-hmm.
Whatever class of music they like.
Whatever they enjoy.
If they like listening to country western music, that's what they listen to. If they like jazz with singing, that's the type they listen to. If they like rock and roll, that's what they hear. If they like opera,
whatever they are
like.
used to, yes, whatever they are used to.
Yes.
In fact, it's interesting that you bring that up, because even in our group, sometimes ago, I think about a couple of months ago, we did have a chat session on music therapy, the melodic intonation therapy or the music therapy with specific reference to stroke. We had, I think, Mr. Kasbe, he's a Indian, settled in India, who has done his PhD on music intonation or melodic therapy. I would just go back, sir, to your, let's say, pre-stroke days, Dr. Bruze. Do you think there were any personality factors that helped in your recovery thereafter? Like,
Well,
mhm.
I did not want to die.
Yes, of course. Strong
That
will to
helped.
live. Yes.
And I tried very hard to improve. I did a lot of exercises.
So would you
I
say that
also,
that determination was there existing before stroke as well in your career maybe, or in your hobbies maybe?
I don't know. Stroke patients are often given an antidepressant
Correct.
after a stroke. I was put on Lexapro for a year, and taking an antidepressant in the first year after stroke does help in recovery. Antidepressants improve the reestablishment of neural connections during the first year only. So that is useful. Also, now this is going to get a little complicated, but I think I mentioned I was put in a drug-induced coma
Correct.
for 8 days. That was very beneficial, I think, in keeping my stroke from being worse. Now, this is going to be hard to explain, but I will try. When the brain is damaged, like with a stroke, that affects neurons that release a lot of different neurotransmitters. One neurotransmitter that is released is called glutamate. And glutamate is an excitatory neurotransmitter. It increases the activity of the neuron that it synapses on. But glutamate is also neurotoxic. It can kill the neuron that it's released on. And if that neuron is a glutamate neuron and it starts to die, it will release glutamate onto other neurons and they can die. That's what you call a glutamate cascade. It's like if you throw a stone into a pond, you get ripples going out from that. So beginning at the central core of a stroke, you can have this glutamate cascade extending neuronal death from the core. Since I was put in a coma, my neurons were not functioning and therefore would not be releasing that glutamate, and the core of my stroke would not get bigger as a result. So in retrospect, I'm glad they put me in a coma. I don't know if that makes sense.
Yes, indeed.
That,
Partly, I think even as layman perhaps can understand that perhaps some activity that could have damaged the more of your brain cells was suppressed as a
yes,
result of your going into an induced coma.
yes,
And yes, even in India, I think, for example, Arvind, I was just reading his story that he had sent. Even he was in a drug-induced coma for some time, if I remember correctly. Even in India, some people are put into that coma for various reasons, not only stroke, traumatic brain injury also would maybe require that treatment. Dr. Bruze, did you consider or did you come across at any time during your recovery what is known as alternate healing, acupuncture, or some people have acupressure there in the US. Here in India, of course, we have a fairly large body. I know some people even practice or try to work with hypnosis. I was reading somewhere. Did you?
I never sought out any alternative therapy. I never had hypnosis or acupuncture or stem cell transplants or anything like that. And I'm very leery of them. I don't think there's any good scientific evidence that they are effective. I would be extremely leery, in particular, of stem cell transplants. There are places here in the United States that charge tens of thousands of dollars for it, and their methods make no sense at all scientifically.
Correct, because I was reading in the US, there are people who, in fact, perhaps even there are some videos on the net. Even in India, yes, people are talking now of stem cell therapy. Whether there is a large scientific evidence still remains to be seen.
Yeah, I mean, it's a nice idea. The only stem cell study that I'm aware of that showed reasonably good results was conducted out in California. Well, I can't remember what university, but it was at Stanford University. And what they did there was to drill a hole in the skull of stroke survivors and put a very long needle through that hole into the central core of the stroke and inject stem cells. And what they found was that the stem cells themselves died, but they released chemicals that triggered the regrowth of some neurons. And that did help patients. Now, these other clinics that spring up all over the place get stem cells from your body fat and inject them into your arm or something. And that's just a lot of nonsense. You're paying a lot of money for a hope, but there's no scientific basis for it.
Talking about that, I was also reading, and I'm sure some of us have also read, there is a drug called etanercept or something like that. Etanercept, a miracle drug, something which will cure.
There's one drug, and I can't remember the name of it, but it's given to break open a clot, like a blood clot, to allow the blood to flow better. And that's useful, but you have to be very careful that you give that to someone who had an ischemic stroke, yeah, and not a hemorrhagic stroke. Because with a hemorrhagic stroke, it could be fatal.
Correct. That is the TPA. That is it's the short form of that injection. Even in India also, it is when you have an ischemic stroke, you have a clot buster or clot busting injection, which is given quickly within the so-called golden window of about 4 odd hours to bust that clot. Yes, but
and
yes,
most strokes, about 87% of strokes are ischemic.
Are in that category. Yes, yes.
About 13% are hemorrhagic. Mine was hemorrhagic.
Yeah, yeah. So you never, you have to be careful, as you rightly said. Proper diagnosis is anyway required before
Yes.
you get into that. Also, so going forward, Dr. Bruze,
Yes.
how do you see, maybe, and going into different directions, anything you feel you, or it might have helped you had you known that before your stroke? Anything?
Well, I should have. I probably should have been on blood pressure medication.
Blood pressure medication.
Yeah. So my wife blames my doctor for that, for not being more proactive. I, of course, didn't want to take medications, and now I'm taking 5 of them. Oh, and by the way, and this is just me, of course, when I got out of the hospital, I immediately checked all the drugs I was taking. Initially, I was taking 8 of them, and I was looking at the main effects and side effects. For one of the drugs I was on, a possible side effect was permanent blindness. And I did not want to do that. And that was a drug that was given for atrial fibrillation, which I have. But I was not willing to go blind to take that drug. So I called my doctor and said, "Can I stop taking that?" He said, "Yeah." I said, "Okay." So he put me on a different drug that does not have that or any serious side effect.
Yeah, but obviously you need to be yourself very, very aware of what you're taking, and to be able to. I'm just curious, while we're talking about doctors again, doctors in the US are pretty open. Like, as you said, okay, don't take this, take this, go for a second opinion if you want. Or are they fairly rigid that they may not even take the time to explain to you what you need or what you don't need? Here it is, take it, and that's it. How is it normally in your experience?
Well, I was put on, like I say, 8 different drugs while I was in the hospital. And after I looked into them, some of them made sense, some didn't. And that's when I talked to my doctors about that. And there was no problem in discussing that.
So generally, yes, they are open to discussing with the patient various possibilities, and yes, that is good. That is good, because in India sometimes we have diverging opinions. Also, of course, the fact that there are very, very few practicing neurospecialists in India, so that is also another issue. Time is an issue. Yes. So going forward, Dr. Bruze, how do you see yourself now? What is the plan going forward?
I'm still trying. I'm retired from teaching now, but I would like to improve to the extent that I can go back to performing magic the way I did before. So I still try to exercise daily if I can. And the problem is, the further out you are from your stroke and the older you are, I'm 73 now, the more work you have to put in for a smaller improvement. But your brain maintains a neuroplasticity until the day you die. And since I'm not dead yet, I'm going to keep trying to improve.
Great. And as you have mentioned yourself, there is a new purpose and new passion to share your journey and your learnings with the other affected stroke affected people. So I think that is also welcome. It's a positive, I think, change. Gives you at least one purpose. That's what I feel also sometimes. That is having a purposeful life as against maybe other things that occupy us. Great, sir. I think it has been a wonderful chat. Anything else that you would like to add in, before we open it up to the attendees here? What would you like to give as, let's say, your tips to the stroke affected here? I'm seeing family stroke affected here, although there are Punimas here, Mitali is here. They are from the stroke professional side. But generally speaking, what would you tell to the stroke affected and the family based upon your experience so far?
Well, I'd say try to be as positive as you can. And I've heard that those people that want to improve, improve. So if you really want to get better, you'll put in the work to get better. And recover from stroke is not a sprint, it's a marathon. So it's not going to happen overnight or over the course of a month. It will take several years in all likelihood. But put in the effort and it will be worth it in the long run.
Thank you. That's great. We are opening it out to the forum now. If you have any issues or anything that you would like to share, I'm seeing some questions on the chat. I will also take them by the by. But meanwhile, if you have any questions or any learnings that you would like to, please raise your hand or unmute yourself, or we will unmute you, and then we can take it further. If any has any questions. Meanwhile, Arvind did ask earlier, did you have any pre-stroke headaches before the stroke? Did you have any pre-stroke headaches, Dr. Hetzler? Did you have any headaches before the stroke? Maybe 1 day, 2 days before the stroke? That's for you, Dr. Hetzler.
I'm sorry, was that a question to me?
Yes, I'm just reading from the chat some questions. And one question is, did you have any pre-stroke headaches before, maybe 1 day or 2 days before the stroke? Did you have a strong headache or a consistent headache?
No, no, I did not. The only possible sign I had was the day before my stroke, I had double vision.
Okay.
But I never had a headache, no.
Mitali is asking, I don't know, Mitali, are you there? Yes, Mitali, you are asking for sharing of radiographic test results. Why would that be of interest? If you can unmute yourself, just for others also to know.
Sure. Am I audible?
Yes, you are.
Yeah. So, doctor just said like his right hand. His left hand was right. It was functional. His right hand was affected, or
No, he had a right brain stroke, so his
My
left
left hand was affected.
your
My
left
left
hand
hand
was
was affected.
Correct.
Yeah, that's
But I
right.
had to wear a glove, an oven mitt over my right hand for the constraint induced movement therapy.
Yeah, so that implies like given the cross connection of our brain. So I mean that gives an impression that you had a right brain stroke because your left hand was your left hand was affected. Sorry, I meant your left hand was affected, and that gives an impression that you had a right brain stroke, and that's why the language was totally not affected. That was one reason why you had good language skills even after your brain stroke.
Yes, my stroke was on the right side of my brain, but language is controlled on the left side of the brain.
Correct.
Your
Yeah,
ability
that's
to
right.
talk is controlled by your left frontal lobe. Your ability to understand speech is controlled by an area in your left temporal lobe. And since my stroke affected my right side of my brain, my ability to talk or understand language was not affected.
Yeah, so that's what I wanted to say that you were lucky that your left side was spared, and that's why you have got all the ability restored.
Yes.
No,
I
but
think
I'm just curious again. Why did you ask for this? How would this MRI CT images? How would that? I mean, what was the context there, Vitali?
Just to know what's the impression was no, it was any cortical issue, cortical side being affected or no cortical side, was it only subcortical? So the space, the lesion side would have given a proper understanding of us, that who would know, although he was in coma, drug induced coma, why his speech language was spared.
No,
So
but of
maybe
course,
there may not be any cortical involvement. So that's why I wanted to just and make sure.
that in any case, as we had said, that it was a right brain stroke. That is, and so obviously, yes, thankfully, those areas were not affected. Otherwise, there would be some speech deficits or some other deficits, probably. Right. I get you.
The language control centers are on the left hemisphere, and my stroke was in my right hemisphere.
Yes.
And therefore, it affected my ability to use my left arm, left hand, and my left leg. But if I hadn't been in a drug-induced coma, the problem in my right hemisphere would have gotten bigger, and the effects on the left side of my body would have been more severe. Now, with a right side stroke, you have difficulty determining what direction you're headed, difficulty walking up and down the stairs, difficulty getting dressed in the morning. In that regard, my wife was impressed that I can dress myself in the morning, but she was impressed that I could dress myself in the morning before my stroke.
I think this is from Usha ji. Can you elaborate on the need of antidepressants? It's in the chat. I'm reading from there. Can you elaborate on the need for antidepressants after a stroke and their role in helping getting over cognitive deficits? If you have any experience to share there, doctor, do the antidepressants help in getting over cognitive deficits? I don't know.
I had no cognitive deficits.
So you would not.
Now, the one, well, you might, the one problem I mentioned was unilateral neglect. That is, I tended to ignore everything on the left side of my body, including things I could see in the left visual field, or feeling my left arm or left leg. But that's not a cognitive problem. And that did recover spontaneously.
Going down. Are you taking any medicine right now for atrial fibrillation as well? Even now, presently? Shruti
I'm taking 5 medications. Those are all, well, 4 of them deal with blood pressure. And then pravastatin deals with cholesterol buildup.
Okay, but nothing specific for atrial fibrillation. Any medication for that presently?
For what?
For atrial fibrillation.
No.
Okay. Then Anuradha ji is asking, any way of making sure not to have another stroke? I don't know if you have anything to share there.
Well, control your blood pressure. Exercise. My doctor, my former doctor, had a sign in his office that said, exercise is the answer to everything. And there's a sense in which that was true. So stay active, exercise regularly, and control your blood pressure.
Yes, movement is very, very important. We see that everywhere. In fact, or maybe I put it somewhere, if you can exercise, it's a blessing. It's not a chore. It's not a task. It's a blessing that you can move. So, one needs to be grateful for that. Arvind is asking, what is the current status of movement in your fingertips? In your fine movement in your fingertips? Can you move your fingertips? Doctor?
My fingertips have a fairly normal sensitivity. I can move all 5 fingers in my left hand, and my fingertips are normal. There is no peripheral neuropathy, as one might get in diabetes. In fact, there was one stroke survivor in a stroke support group that I'm a member of who has diabetes and cannot feel his feet. And I'll probably get the story messed up or something, but he was moving something and dropped a small refrigerator on his left foot. And his doctor asked him if he needed any pain medication. And he said no, because he couldn't feel his foot. So, but anyway, the point is, I have no peripheral neuropathy. I can feel everything with my left hand. It's not completely normal, but it's pretty close.
Great, great. In fact, that reminds me, and I'm seeing Ushaji here. Some time ago, Ushaji's husband is a stroke affected. He's almost 72 years old. And recently we had him playing a bit of saxophone. He plays the saxophone. So, we had him playing saxophone on one of our recent sessions. So, that's great to see that he has that control back. I see on some Facebook groups also, people playing musical instruments.
You can, there is what's called sensory re-education of the hand. So if, for example, you have lost the ability to feel things with your left hand, you can retrain your left hand to feel things. And you do that by actively touching different things with your left hand. For example, rubbing your left fingertips across sandpaper of different grains, or silk versus cardboard versus Scotch tape. Doing that a lot will help to retrain your sensitivity of your affected hand.
Right. I think Purnimaji is saying that fine motor control needs training. If you are missing, but make sure your wrist, elbow, and shoulder are moving well without compensating. That is, Purnimaji is also coming from USA. She's also logging from the US. She's a physiotherapist. He's making that. Arvindji, you have raised your hand. Do you have any comment to make, Arvind?
No, my questions were answered.
Okay,
Thank
fine. Great. So we'll lower your hand. Anyone else would like to make an observation or interact or talk? We are well past, we're almost past 8 now. So if anyone has anything else to add or any, I did request Dr. Bruze, maybe because he has several presentations on neuroplasticity, on spasticity, and two other topics. So hopefully we will have him again, specifically on those over the coming months. That's what I'm hoping for. And I will be in touch with you also, Dr. Bruze, on that.
That would be fun.
And this book that you mentioned, Dr. Bruze, I had made a note of it, Stronger After Stroke. Who's the author there?
I'm sorry, what?
This book that you mentioned, Stronger After Stroke.
Oh, yes. It's in the 3rd edition. It's by Peter Levine, Levine.
Peter Levine, yes.
You can buy that on Amazon here. I don't know where.
It will be available. The Kindle edition will be available.
It's an excellent book.
Great. Fine. Anyone else would like to have any comments, any thoughts? Otherwise, we can close the meeting. Shruti. Yes, Shruti, tell me. You can.
Yeah, hello, sir. Very nice chat with you. My husband currently, now he's 47, but last year he was diagnosed with cataract of the eye. So when we met the ophthalmologist, he said that it may be drug induced. So any thoughts about that? Because at that age, generally we don't find cataract patients. He's young for that. He said he feels it is drug induced.
I didn't quite understand what the question was.
I think she was talking about some drugs. Correct me if I'm wrong, Shruti. And
Yeah.
as a consequence of those drugs, cataract is developing in the eye. Is that what the thought is? That because of some drugs, cataract is developing, Shruti ji?
Yes, that is what the doctor told.
Okay, so it's a side effect of the drugs that he is taking, and that is leading to cataract.
Yes.
Okay, because I think Dr. Bruce, you also mentioned something, side effect of some drug which could have led to weak eyes or something like that.
Yes.
So again, it will depend upon the drug specific, which I'm not sure whether you would have anything to share there, Dr. Bruce.
Well, every drug has a main effect, and that's why you take the drug, but every drug also has side effects. There's other effects that just sort of come along for the ride, and you have to tolerate the side effects if you want the main effect. And it's important to know the side effects and whether or not you're willing to tolerate them. I mentioned one drug, and it happened to be amiodarone, that has a potential side effect of permanent blindness. And I was not willing to tolerate that. So I asked my doctor if there's another drug I could take, and he said, sure, and put me on a atenolol instead. So it depends on you and your doctor, but you really should know in advance, if you can, what the main side effects are of any drug and whether or not it's worth taking.
Thank you.
True, because that would need to be a balancing act. Sometimes turns out to be a balancing act.
Yes.
We take BP medications and they have issues. Also, there are some issues, some questions that I'm seeing on the chat now. Why were you on antidepressant? How did that help? Usha ji is asking that. And how did you handle post-stroke depression, which probably is, connected questions.
Could you say that again? I'm not sure I understood.
How did the antidepressants help you? Why did you take them for a period of 1 year? And did they help you in your experience?
I took the Lexapro for a year because that's how long it was prescribed.
Okay.
And after I was taking it, I checked on the effects of the antidepressant and found that it helps stroke recovery in the first year, but not after that. Whether or not it helped, I don't know. The only way I would know would be if I didn't take it
Didn't take that.
and I was worse off versus taking it better off, because I have no idea how my recovery would have gone had I not taken it. It was not hurting me that I could tell.
But you
So
were
I
not,
just-
you were not feeling like sometimes we here in India that, a patient becomes very passive as a consequence of taking antidepressants, those kind of effects did not occur to you as a consequence of taking
No, I did not.
And that interferes with probably with the physiotherapy also, because the patient doesn't want to, do physiotherapy.
I did not notice any serious side effects. But again, I don't know what it would have been like had I not taken it. Now, antidepressants do have other side effects, and it all depends on whether the outcome is worth it.
Correct.
they help a lot of people. I was not depressed before my stroke, and I got more mad at myself for having a stroke than depressed. So I don't think I've ever been clinically depressed. But again, I don't know what my recovery would have been like had I not taken it.
Yeah, sure. Arvind is asking, did you come across any drugs to increase neuroplasticity?
To increase what?
Neuroplasticity.
Drugs. Well, I'm not aware. Well, other than an antidepressant during the first year, I am not aware of any drug. Well, let's see. Well, antidepressants have their antidepressant effect through a whole cascade of events, but ultimately by causing the production of brain-derived neurotrophic factor in the brain. It's abbreviated BDNF. That stands for brain-derived neurotrophic factor, BDNF. And that's sort of like miracle grow for the brain. Now, that's probably how they help improve stroke recovery during the first year. But exercise improves stroke recovery because, again, through a cascade of events, exercise will also increase BDNF. But with exercise, you only get the increase in BDNF for the body part that is doing the exercise. With an antidepressant, you get BDNF all over the brain, but it's in a much smaller amount. With exercise, you get a lot more BDNF for the body part that's doing the exercise.
Okay. Yeah, that makes sense. Purnimaji is also saying something similar, that doing neuroplasticity is enhanced by doing things you used to do and now attempting to do it in different way. That is what Purnimaji. Jennifer is asking one question, sir. Maybe you have something to share there. She wants to know about your leg recovery. Was it earlier than your hand, or did the hand come back first? Because in Jennifer's case, if I remember correctly, the hand came back first, and she is still having on the leg side some recovery.
I'm not sure. Probably my hand improved more because I used it more. I was initially in a wheelchair, and then I went from a wheelchair to a walker, from a walker to a quad cane, from a quad cane to a single point cane, and now I use a cane sometimes, and sometimes I can walk without it. But I need to walk more or use my left leg more for further improvement. But there was clearly recovery in both. I noticed the spasticity more in my leg than in my hand, but then I used my hand more, and therefore it probably recovered better, more completely.
Yes, sure. Thank you. I think we are past 8:13:15 now, so we can close the meeting. I'm not seeing any other questions also. So thank you very much, Dr. Bruze. It was a pleasure. Thank you very much for your time and efforts.
You are most welcome.
I hope you also enjoyed interacting with our group.
Yes, I enjoyed it.
Thank
It was
you.
very nice.
Thank you.
Thank you for the people who participated.
hopefully we look forward to having you more, as I'm just trying to snare you into that. We'll discuss that. We look forward to that. Thank you very much, everyone. And I'm closing the meeting now. Thank you.
Okay, thank you.